All right. Good afternoon, South Coast. Happy Wednesday to everyone. It's Mike Sylvia with New Bedford Guide Fall Reporter, covering the South Coast. We're doing a weekly interview with the Southcoast Health doctors and professionals. We've been focusing a lot on vaccines and COVID. But this week, we're live with Kristen McLoughlin. She's an NP at Southcoast Health. We're here to discuss lifestyle factors that influence breast cancer risk. So welcome. And just tell us a little about yourself, Kristen, and kind of what your role is at Southcoast Health.
Sure. Well, thank you for having me on the show, Mike, and for highlighting Breast Cancer Awareness Month. I got my start. I studied at UMass Amherst. Studied kinesiology, which is the study of human movement. But a lot of my studies focused on how diet, nutrition, and disease affect the human body. So that's how I got interested in nursing. Went on to become a nurse practitioner. Started my career working in neurology. But after a few years, I was looking for a career change, and I've always had a very strong interest in oncology and women's health. And that's how I ended up at my current position, working as a nurse practitioner at the Southcoast Health Breast Center. And right now I work in collaboration with 3 breast surgeons and 2 nurse navigators, and we evaluate, diagnose, and treat all breast conditions, ranging from benign conditions such as fibroadenomas or breast cysts to breast cancer. In addition, I run our high risk clinic, which is specifically designed to closely monitor individuals who have an elevated risk of breast cancer due to some of their personal or hereditary risk factors, some of which we'll be talking about today.
Yeah, so my mom passed away from breast cancer. It isn't what killed her; it's what metastasized to all the other organs and killed her. So it's something that's important to me.
Very sorry to hear that.
Oh, it's like that. Thank you. So how common is breast cancer, say, compared to other cancers, or just overall compared to other diseases?
So in the United States, breast cancer is the most commonly diagnosed cancer. It is the second most common cause of cancer death in women, second only to lung cancer. Each year, a little over 300,000 women are diagnosed with breast cancer. A more important statistic, I think, and another more positive statistic is that in the United States, we have about 3.8 million breast cancer survivors in the United States.
And there's something that maybe people don't know, but men can get breast cancer, right?
Yes, they can. So men certainly can get breast cancer. It's much less common, but it definitely does occur. And males who have breast cancer are a little bit of a higher risk to carry a genetic mutation.
Okay. So what are the key findings of breast cancer risk factors? Like, what's the biggest risk for women out there?
Yeah, so for an American woman, the average risk of developing breast cancer throughout her lifetime is about 13%. So that's about a 1 in 8 chance. The biggest risk factor for developing breast cancer is being female. As we just talked about, males definitely can get breast cancer, but it's much more common in women. Another important risk factor for developing breast cancer is age. So as a woman gets older, her risk of breast cancer also goes up. The average age of diagnosis most women are diagnosed with breast cancer after the age of 55. Other risk factors that are pretty important are our genes and our family history. About 5 to 15% of breast cancers are hereditary, meaning that the individual inherits a deleterious gene mutation from a family member. And even patients who don't have any genetic mutations, even just having a family history of breast cancer, such as you do, in a first-degree relative, so in a mother, sister, or daughter, it almost doubles a person's risk of breast cancer throughout their life.
So it goes from like 13 to 26%. Oh, I think we lost you.
There you go.
So
sorry about that.
That's okay.
It's okay. Sorry about that. Sorry about that. That was actually a family member of mine calling me.
So when you say doubles, you say doubles, it goes from 13 to 26%, something like that?
Correct. So average risk, just being female, having no other risk factors, is about 13%. So if you have a first degree relative who has breast cancer, your risk would likely double to about 26%. And this is in your lifetime, up to age 90.
All right. So there's got to be ways to lower our risk. Obviously, if it's hereditary, it's you have a higher chance. But is it healthy diet, exercise, that kind of stuff?
You got it. So there's a lot of risk factors that we just cannot control. The only risk factor we can control is our lifestyle. I always tell my patients the healthiest person on the planet can still get breast cancer, which means that lifestyle might not be our strongest risk factor, but it's the only thing we can control. So I definitely recommend these things. Most importantly is to maintain a healthy weight. As women, the more fat that we have, the more estrogen our body makes, and estrogen is sometimes a driver of that breast cancer. We also recommend a healthy, well-balanced diet. So people they can still have bacon and sweets and sugar, but we just recommend don't eating those things every single day. Try to balance them with healthy fruits, vegetables, lean protein. Very important is regular physical activity. So the recommendation is about 30 to 40 minutes a day, but walking counts. So you don't need to do anything crazy. You don't have to run marathons. You don't have to own a Peloton. Just walking outside can meet the recommendation. Of course, we always recommend smoking cessation. There are a lot of studies that suggest smoking can increase the risk of breast cancer as well as many other types of cancer. And then one of the most important risks that a lot of people are not aware of is alcohol intake. So exponentially, the more alcohol a woman drinks, her risk of breast cancer also goes up exponentially. So for our high-risk patients and our breast cancer patients, we definitely recommend the least amount of alcohol possible, but certainly not more than 2 drinks a week. So lifestyle is important.
And getting a good night rest, I'm assuming, is one of those add on there.
Sleep, stress, those are all things that, although there might not be a direct correlation to breast cancer, they certainly impact our overall health and well-being. Without sleep, your body doesn't heal, and certainly stress. So a lot of people are stressed right now with the pandemic. There's a lot of worries going on. In particular, that kind of long-term chronic stress, it really can damage our bodies not only mentally, but physically. So there can be free radicals that bounce around our bodies, and that's what changes the DNA and can lead to breast cancer. So self-care is important. I tell all my patients, blame it on me. Tell, your family you need to get away for the weekend, go for a massage, take a hot bath, take care of yourself so that you can help lower your stress.
Yeah. So if you're a woman out there, maybe over 55, you have put on some weight, you're smoking, you're drinking, you're not exercising, you're just really increasing your chances, right? And that's key to maybe consider exercising, get more rest, cut out some of the carcinogens in your diet, which alcohol is, right?
Yes, it is.
Yep. If you have questions, throw them in the comments, folks. We'll throw it out there. My mom had that high stress, driving into Boston for an hour and a half for work. She drank alcohol, smoked cigarettes, didn't get a lot of sleep, skipped breakfast, ate really bad. So you kind of look back on it and you kind of like, if that's your parents today, do something, say something to them. If that's you, definitely have a more chance to act and do something.
Definitely make some changes. And I think that's one of the most important message I try to give my patients is that it is okay to put yourself first. A lot of males and females are the center of their families. They have a lot of responsibilities. They have a lot of weight on them, and they're kind of the glue that holds their family together. So they do have a hard time taking care of themselves and setting aside time for themselves. But I try to let them know it's okay to take that time for themselves, and they're actually them and their families are going to be better off for it if they can keep themselves healthy and do all those healthy things to keep them on the right track.
Yeah, Susan said, I just got my mammogram and now you're stressing me. We're not trying to stress you. We're trying to give you some info. But talk about the importance of mammograms.
So screening mammograms are very, very important. The mammograms we have now are 3D. There's a lot of 3D mammograms out now. That's the most up-to-date mammogram that you can get. And they're very good at detecting breast cancer, at finding it when it's very, very small. And when we find breast cancer when it's very small, it is very, very treatable. So the most important thing you can do for your breast health is staying true to your yearly mammograms, not putting them off, and making sure that you are aware of the results. And then as well, if you feel anything abnormal, if you're doing a breast exam or you feel anything abnormal when you're in the shower, we just recommend calling your provider right away and getting it checked out. Time can be of the essence, so we just don't want you to delay your care at all.
Is there an age though they should start? Because I think you don't want to overdo it either, right? And get them too early.
Correct. We don't want to put people under any unnecessary, stress or testing. The average age for most women to start is age 40. But certain women who have a higher risk of breast cancer due to their family history, or if they carry a genetic mutation, we sometimes do start breast cancer screening earlier, sometimes as early as age 30. So I would recommend just patients who might have a strong family history of breast cancer to either talk to your primary care provider or come and see us, come see me in the high-risk clinic, and we can help you decide based on your risk factors what would be a good time for you to start screening mammography. But most women, it's age 40.
Yeah. So when you say genetic, I know like Angelina Jolie, she was famous for revealing that she had a genetic mutation and she just preventively removed her breasts. Is that can you just talk a little bit about that genetic mutation or what that is?
Sure. So genetic testing is definitely a big part of what we do. 10, 15 years ago, we really only knew about a few genetic mutations. The most prominent were the BRCA genes. Now we test for about 23 genetic mutations that can all confer an increased risk of breast cancer or ovarian cancer. But the most well-known genetic mutations are the BRCA genes, BRCA1 and BRCA2. And those individuals who carry those genetic mutations do have a much higher risk of developing breast or ovarian cancer. The studies vary, but anywhere from 55 to 70% of a lifetime risk for breast cancer, and about 40 to 45% chance of ovarian cancer. So individuals who have that genetic mutation, we definitely do counsel them on some more aggressive strategies to reduce the risk of breast cancer. And sometimes that does include discussing a prophylactic mastectomy, meaning we are surgically removing the breasts for someone who does not have breast cancer, but has a higher risk of breast cancer. And then similarly, they might consider getting a hysterectomy to remove the areas of the body that place them at a higher risk of developing cancer. So that's exactly what Angelina Jolie did. She knew she had a higher risk of developing those conditions, breast or ovarian cancer, and so she made the decision to just act a little bit more aggressively and do those surgeries prophylactically.
Yeah, and she's one of our best followers. She's always in here asking questions, and she says my mom had cancer at 36, so she just had her mammogram, so she's going preventive. It's very good. So
excellent, Susan. Yep. And if your mother had breast cancer at age 36, that's pretty young. It definitely means she was most likely premenopausal. So that's something that, we definitely would want to screen you a little bit more closely, Susan. Most likely you would qualify for our high risk clinic, where not only do we monitor you with mammograms, but insurance will also cover MRIs of the breast every year. So anyone who does have a strong family history, they are other options that we kind of increase their screening. And that's why we would recommend being followed by a medical provider or someone at a high-risk clinic so they could tell you all about those options.
Yeah, it's so important. And why we do this as well is information is so powerful. If you know, like things like that, you can get a free MRI, that there's blood tests potentially, DNA testing, those kind of things. If you just go talk to your general practitioner, your doctor, have them refer you over, and then a lot of times insurance covers you might not know it, and that's the important thing is knowing what your options are.
Correct.
Yeah, so let's talk Southcoast Health. So what kind of breast care needs can be covered by Southcoast Health Breast Center?
Yes, Southcoast Health Breast Center. So we have a very comprehensive breast health program. We say breast health because we treat many other conditions besides breast cancer. We have a very comprehensive program. We have an excellent radiology department, so they can provide all your screening mammography. We do have the 3D mammograms. They can also do the other modalities such as breast ultrasound or breast MRI. They can do breast biopsies as well as cyst aspirations. I work with 3 fabulous surgeons who can provide surgical intervention for folks who need intervention for removal of fibroadenomas or cysts, if they need removal of any type of atypical cells, or for breast cancer treatment. We also work very closely with medical and radiation oncology at the Cancer Center. So folks who do have breast cancer, we're able to kind of work as a very close multidisciplinary team to provide that full comprehensive care. And we also have physical therapists that specialize in lymphedema management. That's a condition that some women do develop after certain types of breast cancer surgeries. So we have a team to focus on that. We also have a plastic surgery department. So for any women or men who are interested in any type of breast reconstructive surgeries, we definitely have providers who can discuss that with them. And then we also do offer the genetic testing for individuals who may be at higher risk of carrying a genetic mutation.
And where are you located?
So we actually have 3 locations. We have a location in Fall River on Hanover Street. We have another location in Dartmouth on Fonts Corner Road. And our 3rd location is in Wareham at Rosebrook.
Yeah, and these are not the main Southcoast hospitals, right? These are their own clinics.
Correct. Yep. We're close to the main hospital, so we're close to Charlton and St. Luke's and Toby, but we're not on the actual campus of the hospitals. We're typically right down the road from them.
And the best way to make an appointment is that to go through their primary care, or they can call you directly.
Yes, either. People can definitely search us online, Southcoast Health Breast Center. You can read a little bit more about us. There's our phone number, and people can certainly call to schedule an appointment. But also, I would encourage you to speak to your primary care provider about any breast concerns you may have. They can certainly refer you over to us, and we'd be happy to treat you.
Yeah, so Sue says, I was told by my doctor that if I take out your breast, that cancer can go elsewhere. Isn't she talking about metastasis after you have cancer, though?
Correct. Yep.
Yeah.
So ideally, if we're doing surgical intervention, we are doing that surgical intervention before the cancer has spread to other parts of the body. If when we see a patient, the cancer has already spread, sometimes we would discuss if surgery for the breast would still be an option at that point. So our goal is to remove the breast tissue or the breast with the cancer before it has spread to other parts of the body.
Yep, that's the key. All right, so we really appreciate your time. We want to bring experts so people get the information directly from the doctors, and really appreciate your time, Kristen. Anything you want to end with?
I thank you again for highlighting Breast Cancer Awareness Month. It's such an important thing for men and women to be aware of, and especially with the pandemic, we've had a lot of people who have missed their screening mammograms or who haven't felt comfortable to come in for appointments. And I just want to encourage, all patients to really try hard to come in and get your screening mammograms and come in for your clinical breast exams. We are wearing masks and gowns and taking all the appropriate precautions, but we don't want to miss anything. And time can be of the essence. So just encourage people, if you've been putting it off, come in and see us.
And Sue says you accept Rhode Island insurance. I think it just depends, right, what the insurance is.
I think it depends. Unfortunately, that is not my area of expertise. I have a team that works on the insurance, but we do see patients from all over Rhode Island. So I know that we definitely do accept a lot of Rhode Island insurances.
Yeah, I know when you call, that's the first thing they ask, and they just make sure if they accept it, then you move forward. If not, you have to refer you to someone else.
Right, you got it.
All right. So we appreciate your time, everyone. Hope everyone, takes care of themselves and does some preventive checks. Let us know in the comments, what you thought. Share this video, especially if you have a special woman in your life. Everyone should have a mom, a loved one, or someone in their life that they can share the information with. And hope you have a great Wednesday.